These are benign tumours of the liver. So this is going to be a quick mnemonic video with some important information about these benign tumours of the liver. So the most common and most likely benign tumour of the liver is a cavernous hemangioma, which is in the third column. After that, the second most common is in the middle column, follicular nodular hyperplasia. And then adenoma is the least common, but also the most severe, with the most likely propensity for metastasis and turning into something more severe or serious. So let's start off with adenoma. The mnemonic here, by the way, is AID. Don't fall and hurt yourself. AID is for adenoma. Fall is for follicular hyperplasia. Hurt is for hemangioma. So these three are the most important benign tumours of the liver. And let's start with adenoma. Adenoma has an O in it, so I want you to remember the risk factor is estrogen. So women who are on contraceptives have increased exposure to estrogen, so they are at higher risk. Adenoma is the one benign tumour which does present with those characteristic liver symptoms, right upper quadrant pain, and the adenoma may enlarge and become a palpable mass. Is there any risk with the adenoma? Like I said, there is a potential for malignancy, there is a potential for metastasis, so we would excise and resect this adenoma. It also has a risk of rupturing and bleeding, in which case the surgeon would need to intervene. To investigate this adenoma, we would do an ultrasound or a CT, and we would definitively do a biopsy as well to confirm. And the treatment is resection because these do have a potential of becoming more malignant. Next, we have follicular nodular hyperplasia, which is actually due to a congenital vascular anomaly. So FNH tends to form in those people who are born with these congenital vascular anomalies. However, this is once again something that's asymptomatic. This follicular nodular hyperplasia is usually asymptomatic. It does not enlarge. It does not metastasize. This is a pretty safe benign tumour. You investigated with a triple phase CT, and treatment would be conservative if and when they develop symptoms. Lastly, a cavernous hemangioma is a swelling. It's an oma. It's a benign vascular malformation. It's a swelling of the endothelium lining the blood vessels within the liver. Here, once again, estrogen is a risk factor, and oral contraceptive use and pregnancy. Hemangioma and follicular nodular hyperplasia are both asymptomatic. Adenoma, meanwhile, was our symptomatic benign tumour. The investigation is again ultrasound and CT, and with hemangioma, they typically do enlarge in size and then start to regress by themselves. We will typically do an excision, a resection of the hemangioma, or a partial hepatectomy if it's large. Or we would stop the blood flow to the hemangioma, because remember, these are feeding off of our blood vessels, in the hopes that the hemangioma regresses and shrinks in size. Thank you for watching.